Go ahead and tell me your name, please.
My name is Monisha Clayton.
And then can you tell me your occupation, please?
I am a surgical instrument technician at Ronald Reagan UCLA Westwood.
Okay, can you give me a job description, please?
So, the responsibilities of my job include preparing surgical instrumentation and power equipment for surgeries.
Okay. Can you tell me the education necessary for your occupation?
So, in order to work at this job and be proficient at it, I believe you should be certified.
Okay.
There is a certification period that requires schooling and 400 hours of clinical work.
Can you tell me what clinical work is, please?
Clinical work is work that you do in a clinical setting, so meaning at a hospital.
All right. Um, how many? I messed up. I'll edit it out. Okay. How exactly? What is the process for your certification?
So I'll just give you a little bit of my path, the way that I got certified. Uh, Through a grant for the Department of Labor, through the Department of Labor, I went to a school funded through Long Beach Memorial in conjunction with the Department of Labor. And I went there for a period of 9 months. So 6 months of actual class time, 40 hours a week, 8 hours a day, 5 days a week. And then a period of a few months of just clinical work, meaning on site within a sterile processing department, within a hospital setting, within the operating room.
Okay. Can you give me a walkthrough for your day-to-day activities at work?
So I typically work 12-hour shifts from 3 in the morning till 3 in the afternoon. And when I arrive, my responsibilities include making sure that whatever cases they have for that day, whatever surgical cases, all instrumentation and equipment that they'll be using to perform the surgeries is sterile and ready to use.
Okay. Um, are you often times addressed other than what are some nicknames that you may have that other people might recognize you as?
You mean the job itself?
Yes.
Or you mean the job itself, correct?
Yes.
Okay. So in my position, I have like a dual position. I do work as a surgical instrument technician, also called a sterile processing technician. But I also serve as sterile processing OR liaison, the operating room liaison, which means I communicate with doctors, anesthesiologists, and nurses in regards to what equipment they're going to be needing, whether it be for a trauma or a scheduled surgery, for them to be able to perform the surgery effortlessly. So, infection control, we work with them. We are part of that department. Sterile processing technician, surgical instrument technician. Uh, those are pretty much the synonyms for this position.
Okay. On a day-to-day in the hospital, who do you usually interact with?
So on a day-to-day, I am one of 50 in my department, but we work on shifts, of course. So I interact with the members of my department and the managers as well. I regularly work with the charge nurses and the surgeons and the scrub techs, surgical technologists,
Mm-hmm.
and anesthesia technologists, as well as the anesthesiologists and the surgeons.
And would you describe your job as exciting?
The job itself is exciting. It is very hard work. It is meticulous work because you are expected to know many service lines, whether it be for plastic surgery, for vascular, for thoracic, for cardiac, for neuro, for ortho, regardless of the service line, head and neck, you're expected to be proficient and have a great, vast knowledge of what instrumentation they will be using, needing, and calling for. And a lot of the times you have nurses that, although they just work on one service, they may be just a vascular nurse. They will not have the knowledge that you will, and that the doctor will, in order to really assist them in getting whatever it is that they need to perform a surgery successfully.
So, how many instruments on an estimate do you work with day to day?
There are thousands, but I would say, well, let me put it this way. That job does 350,000 sterilization trays a year. So that equates to about, within every tray there's probably 135 instruments, 100 to 135 instruments. So you can kind of do the math. If they do 50, 60 cases a day, there's typically 10 to 20 trays per case. You know, you can do the math. It's quite a bit.
So what are the perks and disadvantages of this occupation?
The perks of this job are, it's pretty well paying. It's a well paying job, considering that a lot of people don't even know that the job exists. It is a well paying job. The perks of the job are, you do gain quite a bit of medical terminology, and you do get to be instrumental in patient care. Although you are behind the scenes, you're a very important part of patient care. Doctors cannot do their job without you, and they're very aware of this. The nurses, the surgical technologists, they can't do their job without you. If the items aren't sterile, they cannot use them on a patient, plain and simple. So that's a perk of the job. A drawback is everything is time sensitive. The OR has a schedule that they want to keep, and time is money. For every minute longer that they're in an operating room, they can't turn over a room to have it ready for the next patient. Time is money. So the job is very much so a matter of being time proficient.
Okay. If you could describe if you could describe your job in a book title, what would the title be?
Oh, wow. That is a very poignant question. If I could describe the job, I'm going to say, is it sterile?
And why?
That would be the job title. Because a lot of people don't know that there's a difference between clean, high-level disinfected, and terminal sterilization. And that's the goal. Terminal sterilization means there is absolutely no evidence whatsoever, whether cultured or not, that anything is on this instrumentation. Anything, blood, bioburden, viruses, bacteria, none of that. That would be the title. Is it sterile? Because there's a difference. There's absolutely a difference. And this job goes in phases. There are different steps to it. It gets decontaminated originally. And decontamination is just a matter of thermal cleaning. It is cleaning at the sink, manual cleaning. And then it goes through a washer to end up on the clean side, the semi-sterile side. And that's kind of where things get thermally disinfected through the washer process. People don't know that at certain temperatures, everything is killed. Everything but Creutzfeldt-Jacobs. But we haven't seen any cases of mad cow disease here since the 1980s. So once something hits a certain temperature, everything dies. So that's a big part of the science that we rely on within that department. And I know this is for your physics class. So we also use biologicals to test the efficacy of a sterilizer.
Which is?
A biological?
Yes.
So we use the biological Geobacillus sterile-thermophilus, which is a live spore. And basically any load that we run, that we would put instrumentation trays in once they're packaged, they will go into a sterilizer that is 270 degrees for 4 minutes of sterilization and 40 minutes dry time. And we use a steam pressure in order to inject steam at that very high temperature to achieve sterilization. There's also a biological included in every single load, and it's incubated at the end by the technicians to make sure that once those items come out, that they are sterile, that everything that could have been in there, including the Geobacillus thermophilus that's included, that it is in fact killed, that the live spore is killed. And that kind of mimics what would happen if there was anything left on the instrumentations after the technicians have assembled the trays. And that's how we assure sterility.
All right. And as a high school student, what would be smart to do to prepare to go into this field or this occupation?
This job, if you are interested in working in anything medical, I suggest you get very proficient with science and math. And this job is no exception. Mm-hmm. Like I said, there is quite a bit of science to what we do. It's not just, oh, we're putting trays together and we're taking them to the operating room. No, there is a lot of science involved. Temperature, humidity, and understanding at what temperature things are killed and what temperature things are just disinfected, as opposed to, like I said, terminal sterilization, which is what you want, of course. And I would say brush up on your sciences and your math so you can have an understanding of what it is you're doing, not just monotonously doing the job.
All right. So, according to the California Career Zone, you would need to know English language, biology, production and processing, public safety, and security to be proficient in this job. Do you have any other suggestions that would be helpful?
Absolutely. So this job, I think, would be a great way to go into anything infection control related. Mm-hmm. And just have, I would probably say, have a love for well, the first thing is you have to have a really good memory. You've got to have a very good memory, because there are literally thousands of instrumentations on these 10 or 12 service lines that you will be working on, that I mentioned earlier, all the different services that they may be performing, whether it's plastic surgery or head and neck or vascular, heart surgery, so on and so forth. A big part of that would be having a great memory, and like I said, knowing science and math, because you will have to do quite a bit of that.
All right. Okay. So, also according to the California Career Zone, you need to be able to monitor yourself, have quality control analysis, mm-hmm. active listening, operation monitoring, and critical thinking. Would you Absolutely. Do you have any other suggestions?
This job is very much so about communication. It very much so is, because the doctors have a certain expectation of when things get done. And anything that anyone knows about surgeons they're very proficient at their job. So they expect the same professionalism. They expect the same high quality work from you. So critical thinking is very important, because there are different avenues that you can take to obtain this sterilization. But you have to kind of think about what is best and what is going to be the most sufficient in providing the best patient care outcome possible, because that's what it's all about. It's all about patient outcome.
All right. Well, do you think the job is very demanding, or would you think it's more relaxed?
Oh no, this job is very demanding. They do first cases every single day, 24 operating rooms at 7:30 in the morning, every day. It does not end. Monday through Friday at least. Weekends, They deal more with transplants, but Monday through